Welcome, everyone. My name is Christina, and on behalf of myosh, I am absolutely excited to kick off the first of 3 sessions of our Psychosocial Safety for Leaders series, which is proudly brought to you by myosh and presented by FEFO Consulting. Today, we're tackling a really crucial topic, psychosocial blind spots, diagnostics to effectively manage those risks and costs. Now, psychosocial risks often go unnoticed until they escalate, which impacts safety, well-being, and business performance. But in this session, we'll explore the most common blind spots, practical strategies to prevent issues, and data-driven insights to help identify risks early. We encourage active participation throughout the whole session today, so please feel free to ask questions and share your thoughts in the chat or via our Q&A box. Now, let me introduce you to our expert speakers. First up, we have Marc Wright, who is the founder of FEFO Consulting. Marc is a trusted leader in risk, health and safety with extensive experience across high-risk industries like mining, oil and gas and construction. He's worked in over 15 countries, led major safety transformation projects and previously served as a prosecutor with SafeWork New South Wales. Joining him is Marc Niemes, a representative for I Am Here Tribe. Marc is a digital learning and leadership expert with a background in business, e-learning and compliance. He has built and sold multiple businesses, led digital learning initiatives at ANZ Bank and co-founded content labs, making workplace training more accessible. So we are so excited to have them here today. I'm going to stop yapping and I will hand you over to the Marcs.
Thanks, Christina. So just a really quick overview of who FEFO Consulting is, and then we can sort of get into the webinar. So as you might appreciate, FEFO Consulting have got consultants in most capital cities across Australia. We have done a few webinars in the past with myosh. Up until last year, we took a bit of a break actually from webinars, but we're back this year. So yeah, really look forward to partnering with myosh again this year and sharing lots of learning for those participants that are on the call today.
Cool, thank you. And I'm the other Marc, and Marc with the C, if it helps for the audience. So thank you so much. And with I Am Here, we're very proud to be aligned with sort of FEFO Consulting and myosh, and we're basically a global mental health and well-being partner. And one of the great things about I Am Here is we sort of have access to what we call 750,000 tribe members around the world. And we're based around the premise that it's okay not to feel okay, and it's absolutely okay to ask for help. And how do we make that work on a corporate level, at a frontline staff level, basically around the world? So thank you for the opportunity to speak to you from Australia.
Thanks, Marc. So I guess today we're going to be focusing on 3 things primarily. We're going to bring to the table a whole bunch of industry insights, mainly from both our data that we've collected through clients, but also some other external sources like Super Friends. We'll talk about how we can use those data and insights to apply to risk management concepts, and then also share some learnings around, okay, well, what do we actually do with the information? How can we actually make some practical improvements to workplaces? Along with that, there will be a webinar offer for those people who have registered at the back end of the call, and we'll also provide some free resources too for those who are interested. So before we get stuck into it, Christina, have we got the poll working today? Are we able to facilitate a poll for the people on the call?
It is randomly not working. However, I'm going to pop it into the chat box. So I will pin it up the top of the chat box so if everybody can have a look at what's on the screen now and put your answer into the chat box. We can put it all from there. So I'll just do that now. Again, I apologize for some reason. It's very strange for Microsoft. Things aren't working.
So the question on the poll is, if you had a choice, and not everyone does, but if you did have a choice, what workplace mental health interventions would you select to implement first? With the understanding
Go on.
With the understanding that often there are strategic choices involved in how you stage different interventions. Doesn't always have to be linear, but yeah, keen to get people's thoughts today.
The majority that is coming through is a psychosocial climate survey. We've got a few Bs, the occasional C. I don't think I've seen anyone request pizza or barbecues, which, oh, there's one. E, with focused conversation topic. I like your spin on that one. That's good.
So Marc with the C was
but business.
Marc with the C was the one who suggested that we put in E, barbecue and pizza. And look, funnily enough, we have seen clients use this as a preliminary step to engage the workforce. So, you know, it doesn't all have to be sophisticated. Sometimes getting down to the grassroots and engaging the frontline supervisors on what they enjoy is often a really good start.
It's not uncommon when we ask the question, when you ask the question of an organization, what's your organization doing in mental health? They say, oh, well, we do have a smoothie day, we have an employee day, we have a lot of it is by some of the organizations saying, no, we this addressed or we are addressing it. But the data, as you'll show with the Marc, we're actually going through it. If you are doing those, still going in the other direction. So yes, it's great to have those things, but are they working? So the measurement around what's working and not working, very, very big issue. The metrics behind that, clearly A is the climate survey.
So Christina, as we progress, can you just let me know if you're having a few issues with Marc's voice, or is that just me?
No, I am as well. Yes.
Okay, that's fine. Marc, you might, depending on how we go, we might just need to double check your connection, but it's okay.
That's cool.
It's good, not great.
I'll change your phones, all good.
Excellent. Okay, so look, there is no one right answer, A through to E. And I guess the overarching message today is trying to come up with interventions that are both relevant and useful for your organisation, depending on where you're at, your context, your maturity, and what's going to be right for your organisation and people. Notwithstanding that, we'll definitely go through some rationale and pitfalls and examples of how each of those things might play out. So I guess with that in mind, it's also worth recognising that this is one of 3 webinars. We also recognise, although today we're going to be focusing on data and blind spots, there's lots of other things we can do in this space. And both Marc and I, we're not psychologists, we're not org psychs, we don't have qualifications in organisational psychology. For that reason, we acknowledge our professional boundaries, and we have partnered not only with this webinar series, but the work that we do with our clients with people that are. So we've got Dr. Liz and Dr. Amanda joining us for webinars 2 and 3 as well to talk about strategy, engaging boards and senior members, and also we'll talk a little bit around building leadership capability as well. That's complemented by what we call our maturity model. So today we'll be focusing on the bottom half of our maturity model, looking at those operational aspects of psychosocial factors and what that might mean for your organisation, and hopefully share some learning that you can take away and learn as well. Complemented with the data from the Psychosocial DX, we'll also share with you some information from an industry leader, Superfriends, and their recent data. As recently as this morning, Superfriends unleashed some more data. So we've Marc and I were very busy this morning updating our deck to give everyone the most latest and greatest information that's relevant today.
I should also stress that the data is getting Australian data touch points. That's nudging now 75,000 data touch points of Australian workers in Australian conditions. So those are the really important things. So we have a lot of data from overseas. You've got a lot of stuff that's post-COVID, but this is now real data from local Australian operations. That's literally less than 5 hours old in its most impressive case. So there's some really good stuff that you can apply in your own organizations.
Yeah, look, absolutely. And look, as recently yesterday too, we spoke to Christina with the understanding that these webinars do have an international audience, particularly from the US. So we've included some US data in here as well. So not only the US data, the Super Friends data, which is based on 10 years worth of psychosocial data, and also some work by Allianz, the workers' comp insurer, that always comes from a credible source. So if with that in mind, we're not going to go into a lot of detail around the history of psychosocial trends, with the understanding that I think it's pretty well recognised, although some areas are improving. If you were to generalise, it's fair to say that workers' compensation claims costs, volumes are increasing. The general sentiment in some areas, although could improve and is improving, there's other areas that are not. So we'll go through those today in a little bit more detail. At the back end of this slide, we've also got a bunch of reference material too, based on the research and the source of data that we've I guess, gleaned a lot of this information from.
Marc, I'd also be interested. Sorry, Marc. I'd also be interested if anyone has any data from the audience type around the type of claims they're actually seeing in their organisations. You don't need to name yourself or your organisations, but if you do want to put that in the chat to say, okay, this is what we're seeing as far as the growth and the types of claims that we're having, or indeed if you're not even measuring those types of claims, because we're seeing some boards coming up saying, okay, we want to stop the claims from increasing. So if any of you have any direct experience that you'd like to share in the chat around the types of claims that are coming through that you haven't had to deal with in the past, we're more than happy to address that in the Q&A sessions as well.
Yeah, thanks, Marc. And one of the reasons we don't want to get too bogged down in claims data is that it is a lag indicator. And we're trying to move organisations towards leading best practice around being a bit more proactive around the management of health and safety. In doing so, you can see here on the screen some benchmark data from our Psychosocial DX. Across the 4 aspects, we're seeing organisational factors performing the poorest. In terms of the dimensions, so there's 8 dimensions across the climate survey that we use. Cognitive and task demand is scoring the worst. And a lot of these results, as we look at some other industry data from Super Friends, it very well aligns. So there's some, I guess, systemic messages here as we go through some of this information to think about what that means for your organisation. And although these are averages based on various benchmarks, it's also worth recognising that it may or may not be relevant to your organisation, and to sort of tailor your own solutions, diagnostics and interventions to make sure it suits your specific needs as well. If we look at the bottom half of the screen, as an outcome to the feedback that we're getting, the outcomes around people's feedback is because of the workplace stresses around job demands and cognitive task demands, the levels of engagement and burnout are scoring quite low, again, which is consistent with other indicators we're seeing in the marketplace. Often people say, well, we know what's working and what's not working. What do we actually need to do? So what we've developed is a bunch of levers to help organisations focus on where to focus their attention to get the best return on their investment. Of those 12 levers, change management is performing the worst. So we're going to delve into change management in a bit more detail today. And positively, trust in leaders is performing the best. So I guess the take-home message here is try and focus on things that are working, not just things that aren't, and leverage things that are working to create that change and improvement that you're trying to achieve. So Marc, from your perspective, working with IM here and your experience, particularly around leaders, is there anything you wanted to share as we sort of progress to the next slide around the role of leaders in managing psychosocial risks?
I'd say the key data that we're finding is that pretty much it's called sort of like the sandwich leaders in an organization. It's those middle manager leaders, those branch managers, those middle leaders in organizations that are feeling the squeeze. So you've got the top executive basically having a performance indicator that they want the organization to achieve. That's then communicated to the middle managers, and the middle managers are the ones that basically need to make that work throughout the organizations. And there's some generational issues that are happening around leadership. I'm looking at the chat as well and the stuff that's coming through. Is there certainly, we do a lot of work with frontline retail, a lot of work with work in the home, a lot of work with where you've got distributed workforces, and we're effectively seeing intergenerational leadership challenges. A 50, 60, 70 plus year old leader having a position description for someone who's an 18-year-old first sort of retail job, what one person's position description is another person's bullying and harassment claim, right? So it's, I mean, it sounds a little bit anecdotal in that area, but the inter-leadership communication between those age groups and demographic groups is becoming very, very prevalent. The second thing is that the leaders, this is not something that just happens to you. This is something that you're actually a part of. So you have to be respectful of your leaders, and your leaders have to be respectful of you. So being able to be in a position in an organization to know what are those leadership challenges that they basically have, and that the organizations, the mental health of the organization actually is a team of individuals handling this, and the notion of empathy. There's often a bit of a challenge between empathetic sort of leadership. Now, that doesn't mean you necessarily need to understand how everybody feels, but you need to empathize with that position. So in the chat, if some of you can see that, we're seeing a huge increase in not just sort of staff to customer or customer to staff bullying and harassment, but the bullying and harassment between staff members. If do you know what I mean? Like if you've got something that it's that sort of good creative tension that we're seeing. So, and unfortunately, that leads to an indicator with some of the US data as well, is that the notions of death by suicide in organizations is not going down. In fact, it's rising at a higher rate than in the general community. So what does that tell us? Is that our environment is basically not helping our mental health. So what are the things that we can do basically around that?
So as I sort of indicated earlier, we have thrown in some international data there. And I don't want to be flipping around just throwing in data. I mean, this is pretty serious when you think about one suicide is too many. And just looking at the amount of death by suicide in the US here, it's actually a really sad circumstance. So I guess as we start thinking around what this means for our organisations, it's great that we can partner with people like I'm Here, but also Super Friends to deeply understand what we can actually do to improve. So, Marc, I know that you've had a fair bit of
just before we go into that one slide, when you're talking about death by suicide, one of the stats that is the most deeply concerning around that is that nearly, according to the World Health Organization, nearly a third of those of the individuals that have death by suicide have never, ever asked for help. So that's why the premise of around I'm Here is that it's okay not to feel okay, and it's absolutely okay to ask for help. Now, from a manager's perspective, the expectation is that they're not necessarily going to be able to deal with that. The manager's not the clinician, the leader's not the clinician. But that stat on its own, unfortunately, the reality of what we see is the biggest uptake in programs that we see around mental health and well-being in organizations come when there is such an unfortunate incident in an organization, because it brings it to light. But when you find that, a third have never asked for any sort of help, that to us then leads to our natural extension is that it is okay to ask for help. And it is okay to ask for that within the organization and to be signposted and deal with that.
Yeah, thanks, Marc. That's a really good point. And as we start thinking around how people respond, I guess hopefully today we'll also mix some interventions and learning around what we can do a bit proactively as well. So with respect to the Super Friends data, I mean, this is an example of some amazing information that was published, I think it was late last year, Marc, 10 years worth of data. Yep. And I guess what this is highlighting is that it's not all bad. There are things that are improving, but there's also a bit of a mismatch around, well, if we are seeing people feeling more comfortable talking around mental health, the stigma is improving, or the education and resource material is more accessible, why are we seeing some conditions worsening and the data and the incidents heading in the opposite direction? So obviously the answer to that's going to be different for each organisation, but I do think it's worth stopping to reflect around if you are initiating some investment or interventions in around this space, is being really clear on why you're doing it and whether or not you're going to have a meaningful and positive impact.
And the other thing, Marc, is there's heaps of reports out there, and if there is an uncomfortableness about that topic within an organization, it's so let me ask the question here. How many of you, so we've got over 100 people on the call. I know it's going to be different from a poll perspective. How many of you have called your EAP if you have an employee assistance program in your organizations? How many of you, the people on this call, not how many of you in the organizations, how many of you have actually called your EAP?
And I step in here and just mention, I have worked in quite a few different industries and different roles, and I had no idea what an EAP was until I started here at myosh.
Yep. And so that's very typical. So the average EAP, if there is such a thing, has about a 1% to 3% utilization. And EAPs have gone from an ambulatory type thing to moving towards sort of a preemptive sort of care type thing. Now, if we acknowledge that how we feel affects our performance, if we acknowledge that, there was some questions in the chat as well that says, okay, is how you feel at home affecting how you impacted at work, and how you impacted at work affecting how you're basically feeling at home. So if we acknowledge that how we feel has an impact on how we perform, then where we get those feelings from has to be relevant for this conversation, right? So if we're at home and we're dealing with the work stresses, we're dealing with cost of living, we're dealing with substance abuse, then that is going to affect us at work. And if we're at work and we've got a bullying boss that's telling us to pull our finger out and just do our job, that's going to affect how we basically feel and basically perform at home. So if we acknowledge that, the question around the EAP is, so we've got quite a lot of answers there. So if I sort of tally them up, it's probably a good 20 or 30%, which is probably historically higher, maybe because the audience type, maybe not. But it also means is that would you call an EAP in the office for a problem that perhaps is affected your mental health from the home and life? So the data we've got coming back with the older generations is that no, they're uncomfortable doing that, right? However, if they slip, trip, or fall at work, have a cut and they need to be bandaged up, they're happy to call the EAP straight away. Or if you need a nurse on call on the weekend, you're happy to call the work EAP if you do have such a thing. So encouraging the staff to call the EAP. Now, if your EAP is a call center based in the Philippines or something along those lines, that might not be appropriate, but they are getting very, very good at triaging and signposting and where you go and where you actually go. So what we're talking about here is the data of the leaders within an organization, of which an EAP might be one of the possible solutions that you're signposting to take away. So if there's anything you take away from today, there are a couple of stats, but the number one is that leaders should not feel like they have to be the clinician to deal with the psychosocial issues or the direct issues. They should certainly signpost them, but they don't need to be the clinicians to deal with it unless you want to. In our stats, if we have 100 people that have gone through our programs, I would say about 6 of them will want to do a mental health first aid course as a result of that. So what we're basically saying is 6% of an organization of people that are interested in organizational mental health want to take it further. But that then means you're moving into sort of a treatment type area. Most managers that we deal with are just interested in performing the job, doing what they need to do, reducing their workloads if they can, and reducing their stress if they actually can, and empower their teams. Most people want to thrive. Most people don't want to injure other people. And that's what we're finding around the data. And if you are interested in that, by all means, reach out to your EAPs, reach out to see if you want to do a mental health first aid. But those then means you are effectively becoming more clinically empowered to basically do that. And then you have a whole other source of stresses around that as well. So thank you in the chat. And we'll try to address all those issues, but that's the stats that we basically find in organizations, that managers want to do the right thing or don't necessarily want to do the wrong thing, but they don't necessarily know how. And I'm pleased to say a little later, we will give you the one sentence a manager can use to potentially reduce claims escalating by 50% in one sentence. So we'll be talking about that a little bit later as well.
So Marc, I've got a question for you, and I know that we know each other pretty well.
Yep.
Do you think that we can limit our discussion around these slides to less than 30 seconds or one sentence?
Yeah.
I know you love a chat. We're just going to run out of time. So, and I'll say that a bit facetiously because I know you pretty well, but there is a fair bit of information we need to get through. And I think what you've raised there, Marc, I think is a really good point around EAP and mental health first aid. What's going to be really interesting is how we delve a little bit deeper to come up with some more systemic organisational factors that organisations can learn from and use as well in terms of managing things proactively. So here are some more stats from Super Friends. So Marc, you've had a fair bit to do with the Super Friends report. Do you want to just briefly explain to us the mismatch we're seeing between sort of managers and the frontline supervisors?
So, and you can do this, 70% of managers, I'm keeping it focused for you, Marc. You know, I'm excited by this topic. So 70% of managers feel that they're good managers, right? And they feel they're good, they want to stay, yet only 20% of their staff basically feel that way, right? So these are new stats here. So the 70-20 comes up again and again and again and again. So here we've got, we plan on staying with our current employer, right? But we're motivated to work hard because the job was interesting and important, right? So the fact that managers feel that they're doing the right thing, but their staff say, no, I don't feel that way, the way the manager says, that's a complete disconnect. So managers feel more so now over the last 10 years that they're addressing these challenges, but their staff are basically saying no. And that's gone up. You can see it's at 85. It's gone from 85% to 54%. So what's changed over the last 10 years is that the amount of managers feeling they're doing the right thing is going higher. The amount of workers that are, or staff in the organization that are feeling that their managers are doing the right thing is also rising, but not at the same ratio.
And I guess some of this data is consistent with what we're seeing around the use of our psychosocial DX as well, in that we are seeing that as an outcome, both engagement and burnout is not great. And with the mismatch, often we're seeing that it's got to do with the capability of the organisation on how they're not necessarily being educated on general mental health and awareness. It's around specific capabilities, around setting clear expectations, around role clarity, conflict, change management, and those leadership skills that you're expecting of an organisation, not only to improve mental health, but general business high performance as well. So I guess as an outcome around the Super Friends data, what the data is saying is that between 40 to 50% of workers with a mental health condition indicate that the workplace is actually a direct cause to making it worse, which is quite an alarming stat. So as we start thinking around how we then apply this from into a risk management context, often organisations can think about how risks apply in this space around the simple things as looking at the job demand, the job resources, and if there's a mismatch between those job demands and job resources, what impact that might have on people and the workplace itself, be it pain, engagement, burnout, etc. So, Marc, from your perspective, I know you're really keen to make sure that we don't get too bogged down in data and theory, and you wanted to have a take-home message for leaders. So
this isn't my message. This is born out of the research that's done by Super Friends and groups and others, and that if and the data that comes back is that if you are a leader in an organization, if there was one sentence you could use when somebody comes to you with a mental health challenge or a mental health issue, this is the one sentence that has been shown by the data over the last 10 years. Over 70,000 people have done these sort of surveys over the last 10 years, that a manager can use to basically prevent escalation of a mental health incident within an organization. So if you can happy to click the next one, right? So it's really simple. A manager is saying, I'm sorry you're dealing with that, but let's look at what we can do. Now, when you break all the stats down, it is so painfully obvious and painfully simple, and in its execution of the empathy. I may not understand your position, but I have empathy towards it, and we are together going to work out how we're going to solve it. Now, if that means you both call the EAP together or whatever, or it means you signpost, by all means, if there's a critical risk factor, escalate it. But in most cases, it stops the de-escalation simply by using the sentence, and that's what the data comes back. So that's a sentence managers can use today, right now, if that basically, and work with them on that. They want to feel heard. The other, oh no, I won't go the other step because of time, but I'll let you go. So managers, use the sentence. It's proven. If nothing else, use the sentence.
Thanks, Marc. So what we'll do now we've spoken about industry challenges, some of the data, and some more practical tips around psychosocial risk. We're going to get into how do we actually apply some of these concepts from a risk management perspective. We'll use the psychosocial DX as an example of how that might apply. Obviously, that's not the only way to do this. There's lots of examples of how you can apply risk management in a psychosocial context, but hopefully it'll in doing so, we'll share some learning on how that could be applied in your organisation. So I guess without telling everyone the basics around risk management, noting the nature of the people on the call are generally health and safety professionals who know risk management inside out, it's probably just worth, I guess, reflecting on before contemplating any sort of intervention around psychosocial risk management is to understand the context. So step one is, where is your organisation at in terms of its maturity? Where's the industry at? What are the organisational goals? What are the other challenges you've got internally and externally? And then as you start thinking around the amount of time and effort you're going to be putting into this, is where are you going to focus your attention? Is it you're going to be looking big picture strategic? Are we looking operationally at specific business units or locations, positions, etc.? And then once you really understand the context and the scope and what you're trying to achieve, well, then obviously you can apply those risk management principles to support whatever that might look like. So today we'll be focusing on the lower half of the maturity level, the maturity model, with the understanding that we'll be focusing specifically on some of those risk factors and psychosocial factors that might impact people on a day-to-day basis, but then also apply a risk management framework to help people work through some potential solutions to improve. So in terms of what that might look like using a climate survey, often people will say that a climate survey on its own isn't necessarily a risk assessment tool, which is true. Notwithstanding that, depending on the nature of the design of the climate survey, you can use different components within that to support a risk assessment. So if we use the concept of hazard ID, inputs could be achieved through survey, observations, or any other sort of review of the workplace. As you start thinking around likelihood and consequence, again, have a think about the job demands and job resources, any sort of mismatch there, and what that means around potential likelihood and exposure. In terms of the outcomes, have a think about various outcomes and consequences, with the view you're looking at hopefully the potential consequence and focusing on proactive activities as it relates to potential outcomes around pain, engagement, burnout, sleep, etc. And then somehow applying a risk management framework to come up with some effective controls. So again, not telling people how to apply basic risk management principles, but in the psychosocial framework, there are some things to think about in terms of the various psychosocial factors that need to be considered when you are looking at the likelihood and consequence. I'm going to zip through really quickly here because there's a fair bit to cover. As organisations start thinking around various controls, one of the unique things around the psychosocial DX is that we do provide levers for action. And as organisations apply that, we often work with them to think about the health continuum, not only as it relates to an individual, but also as it relates to the organisation. Depending on the maturity of the organisation and where you want to focus and some of the risks, there's some things that you can do around response. So as Marc indicated already, how do you respond when things go wrong? What are your return to work processes like? What are your workers' compensation processes like? Through to prevention, and for those more mature organisations and more mature parts of your business, what can you do to promote mental health well-being so people are actually thriving in a very proactive sense and trying to drive that high level of performance? So Marc, from your experience with I Am Here, where do you see most organisations playing in this space along the health continuum?
We looked at, it depends on what industry they're in. We do a lot of work with frontline retail staff and remote workforces. And in Europe, we do a lot of construction sites. And it really depends on which organization type you basically have. Also, construction being obviously male dominated, there's different risk levers there that are employed. But we on most of the time, it's in health and safety and maybe a little bit of prevention, but most of the time we're seeing that it's less prevention and more in a white collar environment. They wait till the incident has happened before they basically do any proactive measures. So for us, it really depends on the organization type. White collar, sort of retail frontline staff, often we wait till it's too late. Whereas organizations around industrial safety have had good metrics around how they manage their industrial safety aspects of areas, but they don't really see necessarily mental health yet as a main proponent of their safety regime, if you're talking about that in general, if that makes sense. So it really depends on what type of organization they're in.
So as we start to progress towards the next stage of the presentation, we will at the back end of this presentation start talking around various correlations and contributing factors that relate to some of these findings. But before we do that, I think it is worth just getting some feedback from the audience. And again, use the chat there. Really keen to understand and hear from you a list of things that you've seen work really well and things that maybe aren't working so well around dealing with psychosocial risks, either in your workplace or someone else's workplace. So I can't see the chat there, Christina or Marc, you might be able to see it.
That's cool. It's coming through. One of the responses, I don't know, Christina, if you want to take them through it, I'm happy to do both.
I'll read them.
Well.
Yeah. So a few of the responses that are coming through so far are leaders admitting they don't have time for this. I mean, it's it's honest, I guess. Intervention conversations, they just have to get over it, is a comment that they've heard. Effective leadership training, one of the best proactive measures. Just build your resilience. I'm assuming that's the tone that they say it in. One of the worst has been conversations with empathy and follow-up. Just be calm. Don't get angry. Weak HR practices or execution of HR practices leading to claims of psychosocial injury from performance management. Leaders labelling it having a me day. Having great counsellors, which is positive. Not acknowledging that there is a risk. And one of the worst that they've seen is stop seeking validation from co-workers.
Yeah.
What are your thoughts on that?
You missed one of the. There's one there that says, what does it say? Take a teaspoon of cement and harden up.
Oh, I didn't even see that one.
And that's the intergenerational sort of issue that you basically come. And they're really one of the great interesting things about going into so many organizations that we do is that it's not just an organizational culture, it's an individual location culture. Every different organization, different location, different plant, different retail, different shop has their own culture. So what is it you can do to basically harness the bits of that culture that are working? And the correlation is absolutely off the charts, where if there's an ineffective leader, there will be more safety incidents. Like, it's just like the correlation on that is very, very clear. But that's just one correlation of many. So it's interesting that the feedback coming back here is that really you see some pretty horrible things, but it's refreshing to see some really, really good things that are also happening as well.
One of the good things that have just popped up, which, like, humble brag, but myosh do really well, is check in on your mate / colleague. And that's not only a manager's task, it's an everyone to everyone situation. And I completely agree with that one.
Yeah. Thanks, Christina.
Yep. You go.
Well, I was going to say, I guess if I reflect on some of the things that Christina said, there seems to be particularly around the negative comments, there seems to be a lot of focus on the individual, looking at the resilience of the individual or the blame of an individual. What we're going to be talking about in a moment is more organisational factors and systemic improvements people can think about applying to their organisation. And based on the data we're seeing, some of the contributing factors that are relating back to some of the results that we're seeing, but also it's consistent with what the data is saying around super friends as well.
Yep. And managers are people too, right? So if managers can make the change, so it's like the people should be the manager they want to be managed by, right? So it's not just excuse the language, but if you're behaving like a dick, right, then you can't expect your managers not to be. But if your manager's behaving that way or inappropriately, then you're going to basically be that. You have the potential to be that way as well. So it's not the key data that comes back to us is it's empathy of an employee for the manager, and it's empathy of the manager for the employee. If we are empathetic to each other's position and we start with that, I understand you feel that way. It's okay that you don't feel that way. Let's see what we can do about it together. Then that's a very significant first step in basically solving that challenge. And it's so basic and so simple. It's not really something that should be just in organizations. It should be in your life everywhere.
So thanks, Marc. As we start moving towards the third section, we're going to start sharing some learning around some of the greatest areas to focus on around trying to improve, some of those contributing factors based on a whole bunch of correlated stats, and the potential levers for action or controls that you might want to think about for your organisation as well. So here is some benchmark data from our psychosocial DX applying the job demand job resource model. What we are seeing, some of the poor results, and this is, I guess, consistent with what Super Friends is saying as well, is that many organisations are struggling with job design and the demands that has on excessive alertness or concentration for the worker, and job design as it relates to time pressure. As you might appreciate, that's not only a mental health concern potentially, but also often when people are rushed, it relates to some physical safety issues as well. Around the job resource component, change management is often a challenge. And we've spoken about that already, particularly around setting clear expectations and then holding people accountable. So that's either the organisations holding their staff accountable or even co-workers holding each other accountable for unacceptable behaviour. Some of those things that Marc spoke about before around bullying and things that are a bit undesired. So as an outcome, what we are seeing, and we spoke about this before, is that it's impacting on both burnout and engagement in particular around the outcomes it's having on workers themselves. So again, if there's a mismatch between those job demands and resources, we are seeing sometimes positive, but also negative impacts on organisations. So up to 2 to 5, 2 people in every 5 are impacting around burnout and engagement based on the data we're seeing. So that, as that applies to, okay, well, what are we going to do about this? As we've sort of suggested already, is that we've got 12 levers that we've been analysing over a couple of years now. And if we just take one of those 12 levers from the Psychosocial DX and delve a little bit deeper to understand some of the correlated outcomes associated with that, what that does do is help organisations drill down to actually understand what interventions they can apply and improve. So if we reflect on what's working well, for example, if you've got some really great relationships with your frontline supervisors, like the data is suggesting, how do you leverage those relationships to improve change management? So from an organisational perspective, what we are seeing, some poor results around change management is relating to job security. Some poor results around setting expectations, particularly during periods of change, and where there's potential conflict within roles or teams, and then also people feeling like they're consulted. So as you can see here, a lot of these interventions or potential controls aren't necessarily providing mental health first aid training to understand and improve general mental health and wellbeing awareness. These are specific interventions that are tackling root causes or contributing factors that are relating to real challenges within organisations. So this is just, I guess, one example. If we're just delving into one specific lever, as you might appreciate, there's a lot more information to be gleaned from doing either a proper psychosocial maturity assessment or risk assessment with the right framework. So this is, I guess, consistent with what we've spoken about before in terms of those 12 levers. The question is, as you start thinking around the strategy for your organisation, change management may not necessarily be the poorest performing lever for your organisation, but as you start thinking about completing a proper diagnosis, really understanding what levers do you need to pull based on the risks within your organisation to get the best return on investment. Often that's not black and white and often takes a fair bit of work, not only in terms of the diagnostic, but also engaging the right people along the way too to come up with the right answers.
Yeah, and that's, Marc, that's also correlated worldwide. So this is using your data here locally for the Psychosocial DX. If you go, say, like Deloitte's sort of global report on the best ROI that can be achieved is if you don't have training budgets, if you don't have budgets for any of this, the data shows us you get a 5-to-1 ROI on just raising awareness. That's it. So if you do nothing else, just raise the awareness of this within an organization, and you have a 5-to-1 return, 5.1 to 1 return on investment. Now, you can get up to a 10-to-1 investment for doing all these other things that come together. But if you just increase the awareness of mental health and well-being within an organization, you're going to get a 5-to-1 ROI on that. That's what the data is coming back. That's what we're seeing around the world.
Yeah, thanks, Marc. So I guess as we start thinking about that 5-to-1 return on investment and the potential to get even more, the question is, what are the contributing factors around some of these outcomes that we're seeing? And what are the reasons why job design is poor, or what are the reasons why accountability is not right, or what are the reasons, as we start thinking about how we would apply safety in a general safety context around doing an investigation or a really detailed risk assessment, it's really good to understand the causes. And although these correlations are not necessarily cause and effect, they do give you a really good indication of the relationships between outcomes and what you might want to do to fix the problem. So if we look at burnout, what our data is saying, the top 3 most correlated questions related to burnout are related to sleep. So as you might appreciate, if people are feeling burnt out, the outcome is they're not sleeping well. The other correlated piece is conflicting job demands. And the last one, people finding it difficult to find time for their own health due to work demands. So again, by looking at the job design and the impact that's having on people's time and job clarity and potential conflict between co-workers, it can help organisations better understand the potential causes that is leading to burnout.
And a practical example of this, Marc, is we were dealing with an organisation that was manufacturing. They had a lot of burnout. They had a lot of people that it was shift work, so there was sleep issues around that. There was parking issues around that. There were safety issues about walking to your car in different shifts. So what did they do? One of the practical solutions of this was to have a 24-hour gym near the organization so people could come in and do their exercise before a shift, come in earlier to get a good parking spot, and actually do a workout and basically get to their shift, right? So these are like a really practical takeaway of things that were in that organization that basically help them feel less burnt out. But the organization did that for the employees, because the employees' work had highlighted those issues. So it was sleep, as you said, shift work, sleep, personal safety, walking to the shift, and parking. So they solved those 3 challenges with a pretty, I thought, practical solution, right? And to basically see if they can start to lessen that correlation.
And that's not too dissimilar to some of the stats that we're seeing from Allianz as well. Often bullying harassment has a role to play here too, as we've sort of seen some of the stats here from Allianz as well. So in terms of the next area, we've spoken all around change management and setting clear expectations. The top 3 correlated responses around my organisation setting clear expectations during change include setting clear expectations with new job tasks, setting clear expectations when there is conflict between roles and others, and the last one being around consulting with planned workplace changes. So, for many people, you might think, yeah, that's obvious, but as you start thinking around what role the supervisors play within your organisation or senior leaders play in the organisation, how do we effectively coach and build really strong leadership capability so they are managing change well, setting clear expectations, particularly with change? It's also probably worth noting too that anything over 0.3 is a positive correlation as it relates to this climate survey. So we are seeing some really positive correlations between some of the information that we're presenting here today. So a little bit less around what the climate survey data is saying. Let's just pause and reflect on what other external sources of information is saying. So we've spoken a lot around Super Friends and their data, a bit around our climate survey data. This is a think tank, which is an outcome of the Super Friends intervention. And as you can see here, there's some consistencies around what we're seeing with the data as well. We're not going to go through them all because there's just too much information, but we've selected 2 for today of the 5 domains from Super Friends around safety and capability. And as you can see here, the think tank priorities as it relates to trying to improve mental health in the workplace is completing effective risk assessments, trying to ensure that interventions are company specific, and a focus on job design around improving psychosocial safety in the workplace. In terms of building capability, their recommendations is to be really clear on the metrics so you can then measure the effectiveness of your interventions. Similarly to the recommendation around making it company specific is making your interventions demographic specific. So as you might appreciate, depending on the age, the gender, the position, the interventions could be different within your organisation. And then lastly, making them sustainable. So trying to ensure that whatever you're introducing is in a short-term measure, that it's actually integrated and it's building a high-performance culture in the long term of your organisation as well. Over the next course of the second and third webinars, we'll share with you some other tips and tricks from the think tank priorities as well, particularly around job design and leadership. Just mindful of time here, we've got about 5 minutes to go, Marc, so allowing a bit of time for some takeaways and any sort of last thoughts that you have there, Marc, too. But a couple of really good takeaways from today is before you start your intervention, understand the context of your organisation in terms of the maturity and where the business is at. Really focus on whether it's going to be a holistic strategic approach, or you being a bit more specific around specific areas or operational hazards within your organisation. Having some sort of method to diagnose or assess the challenge that you have before you're jumping into solution mode, along with really building capability within your workforce to ensure that your leaders are empathetic, managing change effectively, and looking at the continuum from when things go wrong all the way through to driving prevention and promotion so organisations are thriving in an effective way. So, Marc, from your point of view, is there any other takeaways that you really want to emphasise for people on the call today?
No, just the active listening and empathetic leader, and leaders are people too, and be the leader you want to be. Effectively, people should be the leader they actually want to be. And as was said earlier, is check in on each other. It's just a simple check in. How you feeling? And the stats show us to say, ask the question, how you feeling, not how are you. Ask, how are you feeling? And be prepared, if you have a question about a mate, to ask the same question up to 3 times. Okay, so that's what we're finding in the stats, is that, how are you feeling? No, really, how are you feeling? And if they tell you at that point to leave them alone, leave them alone. But if you suspect that someone has a challenge, ask them up to 3 times before you get annoying.
I couldn't love that more. Thank you so much, Marc and Marc. Before we go, I just wanted to, I'm going to add this link into the chat now. This link here, guys, is for you, anybody that is interested in registering for the masterclasses that FEFO are providing. I could not recommend that highly enough. And one thing that I really want to emphasize on behalf of you both is the one sentence to take away is, I'm sorry you were dealing with that. Let's look at what we can do. I felt like that is so minimal, but it's so powerful because it immediately would make that person not feel alone and wanting to be working together with their employers and just making them feel heard a little bit more.
It's not our data.
Exactly,
it's literally, it's a simple thing. Don't do the complex, just do that. And you're 50% better than you were when you started.
Easy, it's free, it's simple to remember, and it's obviously so effective. Marc, thank you so much. Everybody, up on your screen, you will see a few QR codes. So if you would like to screenshot this, please do so now, and then you can access the sample surveys and risk assessment templates. However, if you don't have time, I will be sending out a recording of this session as well as links to both the I Am Here tribe. Sorry, is that the correct word, tribe?
Yeah.
And as well as all the information from FEFO. I know somebody asked if we could provide some details for you, Marc, with a C. So I'll definitely include that in my communications after today's session.
Sure.
Also, just
we're
quickly,
happy to stay on. Like we just want to keep people. We absolutely respect your time. We're bang on for the time. If anyone has some questions, we're happy to address them or make another time to address them. If by all means, go about your day. But if there's, I know Marc's happy to go through any of the data. If anyone has any questions around the data, and we can knock that over the next few minutes. We're not going, but if you need to go, by all means, we respect your time and thank you for giving us the time in your day.
Perfect. Jane, yes, the session is recorded. Like I said, I'll be able to pop the recording as well as all the information that was unpacked here today, as well as the slides. Also, just to remind you all, March 20, so this time next week and the following week, March 27, is sessions 2 and 3 of this Psychosocial Safety for Leaders webinar, and we'd absolutely love you to join. Included in my email after this will be the links to register for that. So please feel free to do that. I'll just check if there is any questions. Also, just with all the...
there's one more says, how do you help define what is a good work demand and an unfair work demand? Marc?
Yeah, look, I think it's a really broad question to ask. We use a Likert scale as part of our assessment, and depending on the nature of the job demand. So if it's bullying, for example, you know, the tolerance for bullying is pretty low. You know, there is a difference between banter and bullying, of course, but we use a Likert scale and a weighted scale depending on the nature of the job demand. So if it's something really simple around you know, a simple job task versus bullying, it really depends on the nature of what's being asked.
There was also a statement here, ask how you're feeling, but be prepared to take the next step in working towards finding ways to help. And that ingenuous questions erode trust. So if this situation presents itself, just like talking to your spouse or your partner or whatever, put your phone away, put it off the desk. You know, you're there be present for those 5 minutes, whatever it actually is, to solve that problem for that person. It just, you don't necessarily have to solve it. You're not solving it. You're telling them what you're going to do together about it. And it can be as simple as sort of 5 minutes. So that was the statement that just came through. Were there any other questions here?
I will mention as well, I'm going to collate all the questions that went unanswered today so that we can address them via email, via a chat, or even in the next couple of sessions as well. So I'll share those questions with you both, Marc and Marc with a C, and we'll see what we can come up with.
One of the great things about FEFO is making sure that this works at the front line. So I know FEFO is really big on making sure that this works. So putting the theories in the lab is one thing, but having the theory like with FEFO and then combining that with the practical realities of your organization, that's some of what the masterclass is designed to go through with the team, is to just, what can we do to basically get this going in the realities of where we are right now, not just the theory and the stats. And that's what I know what the team at FEFO and Marc are so good at doing, is understanding those dynamics, and myosh as well, knowing how that actually works. So the answer is within this community already. So thank you everyone for being around, and yeah, we're happy to wrap it up. If everyone's happy, get them back to their days.
Amazing. All right. Well, thank you so much again, guys. And thank you everybody in the audience that's still with us. We will see you all hopefully next week.